Hi, my name is Janine Paulus. I'm a certified aesthetic nurse at Chicago Aesthetic Surgery Institute in Rosemont, Illinois, and I'm going to show a treatment today, which is a very common treatment that a lot of people are searching for and looking for, which is a toxin, better known as Botox or Dysport or Xeomin. So normally the people that come for these treatments are people who want to get rid of the number 11s between the eyes, or the crow's feet, between the eyebrows rather, and the crow's feet around the eyes, or the lines across the forehead. These are the typical wrinkles that form with facial expression, which are perfectly normal. We just want them reduced. So this is Joanna. We're doing our treatment today for Botox for her. So she has beautiful skin. And just a little, this is a great age to start because we're going to prevent the formation of permanent wrinkles on the face. So when I look at her, she has a little bit of heaviness in the brow. So our toxin will actually raise that up. And so I'm going to ask you to make some facial expressions now. So raise your forehead up. So we have some of these wrinkles that form when she raises her forehead. So they're not wrinkles at rest. They're wrinkles that occur when she's making, faces or expressions with her face. Now make an angry face. So these are the two wrinkles that typically bother people the most. This area is called the glabella area, so we're going to knock these muscles out so that she can't make these number 11s. These wrinkles, if we start doing this young enough, they won't become etched in, so that in 10 or 15 years from now, she's not going to have these really deep creases between her brow. And then we're going to do the eyes. So squint your eyes. Okay. So you can see she has more of her wrinkles on the upper pole on both sides. Some over here. This is called the fan. So she kind of has some wrinkles on the full fan. So we're going to treat these little crow's feet here around the eyes. So it's a quick treatment. It's relatively painless. And the result, you can begin to see the result within depending on the product used, 2 or 3 days or up to 2 weeks. So just a quick word about neurotoxins. What I want to do is show you that the one people know the most is called Botox, and Botox is sort of like the Xerox, but it's actually photocopied. So these are all called neurotoxins. So we have Botox, which is the most well known, but equally effective, and just the duration and the time of onset of beginning to work is a little different. You have Xeomin and you have Dysport. They're all called neurotoxins. So I'm just going to refer to them as toxin. They're all good. They work the same way. They inactivate the muscles so that she can't make those expressions. She can still move, but she won't be able to make these really deep lines here. Another thing is the goal with neurotoxins is to reduce wrinkles on the face. The goal is not to take away all facial expression, because when you smile with your face, and you smile with your eyes and your forehead. So you want to have some movement, you just don't want to have these really deep etched in wrinkles. So the first thing I'm going to do is actually show where the wrinkles are. So I'm going to have her make a face. So make an angry face. So we have some horizontal lines over here. This muscle here is called the procerus muscle. So I'm going to put the first little injection here. These are the muscles that pull the brow down and in that cause the number 11s. This muscle here causes these little horizontal lines here. So we're going to get the head of the muscle and the tail. Raise your forehead up. So usually we try to stay above the halfway mark on the forehead. So we'll do just a few drops here. If you look at her forehead, raise it again. There's a little bit of a divot here that comes. That's because the muscle of the forehead sort of splits. And typically there's no muscle here, so there's no reason to put some Botox up in this area. What we don't want to see is a spock. So now squint your eyes really tight. So you can see these muscles are creating these crow's feet here. So this is going to be our injection point on both. And you can see by doing this, it's going to inactivate the muscle, which is going to raise her brow a little bit like this. So her eyes will be much more open. And I think that's something that's a really a great benefit because it just opens up your eyes and the heaviness from the upper lid goes away. What I don't want to see is having the brow drop. I want to see the muscles, the wrinkles softened, and I want to see this brow lifted up, but I don't want to see it doing this. That's typically called a Spock. That's what we try to avoid. So I put a drop here. As I'm trying to lift this, I don't want this to go too high, so we'll just soften this over here. I did use numbing cream on her. It's up to each individual patient if they want to use numbing cream or not. Some people are fine. These are teeny tiny little needles. You can't actually feel anything going in. So we're going to start. Are you ready?
I'm ready.
Okay. So she's already been cleaned up before we started. And she has numbing cream on, so I'm going to just clean it a little bit before. And then we'll start our injections. I'll put this down just a little bit so you're comfortable. Just going to wipe this off with some alcohol.
And we do have a live question that says, I'm 25. Is it too early to get Botox?
Well, 25 is a little bit young, but everyone's anatomy is a little bit different. So if you're 25 and you have wrinkles at rest, then maybe it would be time to start. Typically, usually towards the later 20s, early 30s is a good time. And you only use as much as you need. So if someone has like really deep etched in number 11s here, but the rest of their face is okay, then you can just treat the one area. So this is going to be our first injection over here. These are just my guide marks. I don't actually put the needle into the mark. I don't want to pull any of the marker into the skin. How was that?
Great. Didn't feel a thing.
And we do have another live question that says, how soon do you see results from Botox?
Typically, from Botox, we'll see results probably within 5 to 10 days. From Dysport a little bit sooner, and from Xeomin also about 5 to 10 days. I'm going to put a tiny little droplet here. So now I'm actually going to go on that side of the chair so I can inject the other side. I always stand on the side I'm injecting. So this brow, you can see it's just a little bit lower than this one, so I'm going to try to raise this a bit more just by moving my injection site up a little bit.
And another live question asking, how long does Botox normally last?
All the neurotoxins last about 3 months. So this is something that has to be repeated. So that's both good and bad. If you like the way the Botox looks, then it can be repeated. But if you don't like it, if you think you don't like the frozen look or there's too much or too little, it can always be altered the next one. But once Botox or the toxins are in, they're in for 3 months. So you have to really be pretty sure that you know, that you understand what your expected result is. So we're expecting, Joanna, we're expecting her to have less movement between the brows so she can't form these number 11s. and we don't want to have any etched in wrinkles here, so she'll still have facial expression, but less on her forehead, less over here, and she can still smile and see the smile lines, but not the etched in crow's feet.
And we have another question. Do you ever use toxins anywhere else on the face or only on the forehead and around the eyes?
So this is on label. The company Botox Allergan just got the FDA approval to treat the forehead, so it's an FDA approved site. So you can use it off label, which is perfectly fine as long as your physician and your practitioner says that we're going to use Botox for other parts of the body. You can use it. For example, if someone has, they call them bunny lines when you squint your nose. Some people have really deep etched in lines over here, so you can put a couple drops over here. Some people have a lot of problems with the TMJ. They grind or bite their teeth at night and they start using the muscles of mastication a lot, and their jaws hurt them. So you can actually weaken these masseter muscles without actually knocking out your ability to chew, and it reduces the pain in your jaw over here. Botox is also used for headaches, FDA approved for headaches. That's a whole different series of injections. You can put them, if you want, around the lips, tiny little droplets to soften the lines, sometimes called smoker's lines to the lips, although it happens to people that don't smoke. It can also be put in the chin if you have a lot of marbling or wrinkling in the chin. That usually happens with our older patients. You can have what they call a Nefertiti necklace, so some people have a lot of webbing from the platysmal bands on the neck. You can also treat the neck. So basically Botox can be used for a lot of different reasons. It's used for medical reasons, hyperhidrosis or irritable bladder. Those are medical applications of Botox, and they're also very effective. What we're doing today is aesthetic. It's to improve the appearance of wrinkles on the face.
And we do have a question that says, if someone also gets laser treatments, can they also get a treatment with toxins, or will the laser affect the toxin treatments?
No, they won't. It's actually a combination I do all the time. I'll do laser and phototherapy. It's very effective. Laser and phototherapy both treat the skin, helps take off a lot of the sun damage or broken blood vessels on the skin. And it's actually, they work well together because as the skin is healing, the toxin will help keep the skin smooth so that you don't heal wrinkles back into your skin, especially the more aggressive wrinkles. These are just little droplets. This muscle on the forehead is quite large. It's called the frontalis muscle. It spans the entire forehead. So we want to make sure that we weaken the muscles equally so that you don't have, for example, wrinkles right underneath your hairline and none over here. I'm just going to check again. Raise your forehead. And both sides aren't equal. One side may have more wrinkles than the other. For example, the driver's side, you may have more sun damage on one side. You may have more wrinkles on the driver's side, especially people with light-colored eyes. They're more photosensitive, so you may actually squint more on one side and without even realizing it. But I think we're good. So now I'll clean this up.
And another question we have is, do you suggest phototherapy along with Botox every 3 months, or would that be too often with the phototherapy?
It wouldn't be. Okay. Especially people who are outdoors a lot, they're very athletic, they run, they play golf, they play a lot of sports, or they work outdoors, or just someone that has even previous sun damage. It's always good to do phototherapy. there's many studies out that shows that phototherapy actually reduces a lot of the damage done by sun and by wind and by the elements. It also helps regenerate the cells of the skin so that the skin behaves as though we're about 10 years younger. So I would say probably 70% of my patients will get phototherapy at least once a year, and many of them 4 times a year with each Botox treatment every 3 months. They end up at the end of probably a year, women actually stop wearing face makeup because their skin looks so pretty from the phototherapy. And then the smoothness from the lack of wrinkles on the face, they can actually just wear eye makeup without having to wear face makeup, if they want, of course. And then they may wear blush or something, but phototherapy really rejuvenates the skin. It looks very healthy and luminescent, and it's a great treatment, great anti-aging and great maintenance treatment. So this is what's left after Botox. That's a beauty mark. No, it's not. Okay. So little red dots, these will be gone by the time she leaves here. I'll put some lotion on because this is alcohol and it's a little bit drying on the skin, so I'll put some cream on her skin so it's not dry. I ask my patients to come back about 10 days later so I can check it to make sure everything looks good and it's the result that she was looking for, that we don't have any wrinkles that possibly were missed, or that the brow didn't raise too much. But usually this is fine because you can see the activity of the muscle. So just a quick checkup about 10 days later, just to, especially for my new patients, I want to make sure that this is the pattern that works for them. It's documented in their chart exactly where the injections were placed and how much. I also have the photos. We did photos before we started. I have photos that shows her muscles with a lot of movement before Botox, and I can compare that to 2 weeks later when the Botox kicked in, and we'll see how much her wrinkles have improved. So how was that?
It's great.
Painful? No?
No, painless. There's no pain.
And how about for men? You know, I'm 37 and I'm starting to get I'm starting to get a couple of wrinkles and so forth. Oh, I appreciate it. Thank you.
Yeah, actually, so men have different issues than women. Women always look for a very natural, soft, almost perfect look on the face, whereas guys want to stay a little bit rough and rugged. They don't want the same degree of correction usually that women do. But what they do want is to get rid of these, they call them these, the number 11s. They don't like the crow's feet, and very often they don't like the lines, their smile lines. So this actually is treated with a filler, and the wrinkles here in the crow's feet are treated with one of the toxins that we just talked about earlier. So for men, for example, that are going into the work field or they're looking for new jobs, competing with some of the younger guys, in their 20s that just finished college, it's really important for them to look good. It's not to make them look too too delicate in the face. You still want to keep the masculine look to a man's face, and that can be done quite easily by reducing the dynamic, they call them rhytides, the dynamic wrinkles on the face and the crow's feet. And then you just look refreshed and well rested, and I think for men it's equally important. This isn't just something women can do, this is something men can do. And again, the goal isn't to freeze the face, the goal is to have a natural look with less wrinkles. And that's doable for men and for women. And again, men usually do it for a little bit different reasons, but the result at the end is the same. You want to have a nice, soft, natural look, some movement, but not deep etched in wrinkles that add 20 years to your face. You sort of want to look as good as you feel. So,
how do you feel?
I feel great. I don't know. We'll see. Yeah, but it didn't hurt.
The needles they're tiny little needles, so they shouldn't hurt, and there shouldn't really. I mean, it's not impossible that you wouldn't have a bruise, but it's pretty rare that people will actually bruise. And I don't think you're going to have any, and I think you'll have a really nice result. You have pretty skin, healthy skin.
Okay.
So I would just say use sunscreen when you go outside. That's really critical.
I
You
do.
want to preserve your skin and keep it healthy so that it stays healthy throughout your whole life.
Mhm.
And when you start these treatments early enough, you actually help prevent wrinkles from forming. So the surgeries they used to do years ago, the facelifts and the big eyelid lifts, we actually don't do that much of them anymore. The majority of it now actually is non-surgical treatments, things like a neurotoxin, either Botox, Dysport, or Xeomin, and some of the fillers to help reduce the signs of aging, the smile lines called nasolabial folds or marionette lines, and some of the sagging of the jowl. So if you start this young enough, and 30s is a good age, 20s maybe a little bit young, again, unless it was really deep etched in wrinkles, and sometimes that's just familial. They're born with deep wrinkles and they have them their whole life, so you can actually treat some of that. So the sooner you begin some of these treatments, the better you look as you reach your 40s, 50s, and 60s. And 70s. I have patients in their 70s too.
Okay.
All right, so what I'll do is I'm going to ask you to come back in about 10 days. We'll make an appointment.
Okay.
It'll be a quick visit just to make sure that everything looks the right way and that you're happy with your treatment. And if we do have to do a touch-up, we would do it at about the 10-day mark, not sooner than that. Okay?
No problem.
And we do have one final, right before we sign off. Does Botox help with acne issues?
Actually, it does. These are all off-label procedures. The toxins help decrease the activity of the sebaceous glands in the face. So sometimes what patients will report is they have a breakout on their forehead, sometimes on their cheeks. When they get a toxin on their forehead, they notice their pimples go away, which is pretty common. So you can actually do these little meso droplets of Botox to the skin to help knock out the activity of the oil glands of the face that are one of the reasons that people do get pimples. Their oil glands are very active and they get clogged, and then pimples form on the skin. So keeping the skin really clean, and then sometimes if it's worse, you can actually use some toxin there to help sort of help the skin get a little bit less oily. She doesn't have that problem now.
All right.
You never had. Yeah.
All right. Well, thank you very much, and we're going to sign off now.
Thank you.
Thank you.